Johns Hopkins University hosts a town hall event today focused on the coronavirus.
Medical reporter Liz Bonus shares why this one was not all about you.
Hey there, everybody. Hello to you. This was all set up as a fireside chat with the nation's top infectious disease doctor to discuss health policy. But as you know, in a pandemic, a lot of the best ways to manage delivering care also top of mind.
This is a historic pandemic, the likes of which we have not seen in our own civilization here for 102 years.
The good news is a pandemic, such as the coronavirus pandemic, is a rare thing. The bad news, it does show us how vulnerable we are as a nation to the quick spread of an illness, which means we should likely be looking ahead to all of us as being part of the solution to protect against the next one.
So, for example, in the United States, and it's not just confined to the United States, we have the realization that there are the need to develop interventions in the form of vaccines and therapeutics for diseases that may not be the kind of commercially viable interventions, but the world needs them.
The real message, however, of this town hall, three things. First, everyone, everywhere, is still vulnerable to the coronavirus.
And anyone who thinks that this disease is going to stay restricted to an epidemiologically restricted group doesn't know much about infectious diseases, because the chances are that it's going to be a global issue.
Second thing is that the infection protection steps that you take, from good hand washing to staying away from others, is not all about you. It's about those you love.
There are people who look at the disease and say, you know, if I'm a young, healthy person, the chances are nothing is going to bother me. So they don't want to participate in the control of an outbreak that for some people, for those people, this is a very serious threat.
And finally, real public health practices will help us continue to live with this virus.
People think that we want to shut the country down. We don't want to do that. We want to use public health measures in a prudent, careful way to help us to reopen the country.
Specialists say this is especially important to remember right now because we're all suffering from what is being called COVID fatigue. It's the exhaustion that comes from trying to be careful when that requires extra time, effort, and safety steps with things that used to seem a whole lot less complicated. We're all feeling it. I'm medical reporter Liz Bonus. Throw it back to you.